coming up to 7 minutes to 6 on ABC Radio Melbourne Drive. How do you feel about medical trials? Are they something that you're wary of, or especially if your own health is at stake, are you keen to take part? New research shows that patients who do often have better outcomes. That's the finding of the Cancer Council of Victoria. And the call is out for more people to take part. Dr. Dishan Herath is the Director of Cancer Services at Western Health. Dr. Herath, welcome to Drive.
Hi, Ali. Good to speak to you.
So can I just ask about this research, first of all? How definitive was it about people taking part in medical trials and getting a good outcome or a positive outcome? Because I guess the very nature of a trial is that we don't know, which is why it is a trial.
Absolutely. So to be clear, I think the Cancer Council's data more recently has looked at trial participation in Victoria and has shown that that has increased over the last 5 years. But there's also data from Cancer Australia quoting external studies that has shown that as an overall group, patients who participate in cancer clinical trials do better. And we think that now that doesn't apply to everyone. There are individuals who will get side effects from the treatment and will become sick. But if we look at the overall group, the results do seem to be better. And there's a few reasons for that. I think part of it is that they're getting access to new treatments. Part of it is that they're being intensively monitored for things like side effects and effects of the treatment.
And yeah, well, indeed. I mean, and I guess that's why you would take part, isn't it?
Absolutely. Look, I think that really, if you're looking at why people would take part, one of the key reasons for patients is hope. So that they want to have hope that they will be receiving a treatment that will lead to a better outcome. But another reason that people participate is altruism, that they really want to help others. So even if they don't derive a benefit from the treatment, they're contributing to research that's going to help others in the future.
So why do you think people don't take part? On the other side of the coin, what do you think is driving that hesitancy?
So it's not just hesitancy. I think one of the challenges is that if we had everybody who wanted to be on a clinical trial, not all of them would be able to access it. So some of the reasons are that these trials do have what's called eligibility criteria. So we look at matching the patients to the trials. And again, this is part of making sure that, that the treatments do have a chance to help them. And part of it is also that they need to have a certain level of fitness. For most trials, they need to be reasonably fit, and that's to be able to handle things like side effects, extra visits, those sorts of things. But we are well aware of those limitations, and we're looking at expanding trials into other areas that would give some of those, more frail people access to clinical trials as well.
Well, indeed. I mean, I think the number is 5.5% of cancer patients take part in trials. Do you think that there would potentially be 20% of people who would like to if they could? So it's not a lack of willingness, it's more a lack of suitability or available places?
I think that it's both of those problems, to be honest. So I think you're absolutely right that if there was more availability, 20% would participate. But we certainly have people who would be suitable, who are hesitant for various reasons, and they're often very good reasons. I think part of the informed consent process that we go through is that patients do get an explanation as to what could happen on the trial, the benefits, but also the risks of side effects. And they can make an informed decision. And then even when they've signed a consent form, that's not a contract. They can still change their mind later and withdraw from the trial. The form gives us the permission to start the process, but they can still change their mind at any time and withdraw.
But it also, someone very close to me was very lucky to be part of a trial, and it gave access to something that they would never have been able to get access to.
Absolutely right. And I mean, I've certainly seen that in my career, that I've seen people who have had access to new treatments, and when you see a great result, and it's not with everyone, but when you see those great results, it's really great, frankly, for the staff caring for the patients as well as for the patient.
And what do patients say, patients who are taking part in trials that you speak to?
Look, overwhelmingly, the response has been positive. Most of them are very grateful to be involved. and frankly, even the ones who've got side effects and things have gone wrong, we've certainly tried to be very open and honest about why that's happened and things that have happened. And many of them have said, I wanted to participate because I wanted to have hope and I understood what I was getting myself in for.
So if people are interested, where do you go? Is there sort of a one-stop shop for medical trials?
I think for cancer trials, I'd strongly recommend Cancer Council Victoria. They have a website that's cancer. The easiest way to find it is just to do a
quick search
for Cancer Council Victoria trials. Put those search terms in and that'll come up top search.
Thank you very much for talking to us.
Pleasure to talk to you.
That's Dr. Dishan Herath there, the Director of Cancer Services at Western Health. Well, coming up to the 6 o'clock news. After the news, Anthony Green's going to join us. Of course, he knows all things